So today's my prime objective would be to look at how sex chromosomes, the 23rd pair, acts and involves in the development of the sexual characteristics in human being. And together with this, I'll be speaking a little bit about some of the abnormalities that you can see. However, it's a bit of a complicated lesson, and also it requires the knowledge of few certain sophisticated facts. So therefore, I would be looking at this in a very elementary manner, not be going into the details. So, so I would like to start this with some of the questions that has been asked, as well as some have that has been appeared as statements in MCQ. So this is about the sex chromosomes. So before starting this, I just want to give a brief idea about how the usual sexual characteristics are formed and how these sex chromosomes, the mechanisms of the sex chromosomes that comes into play. So just now the 23rd pair of the human chromosomes acts as the sex determining chromosomes. So it could either be 2XS or it could be XY. I'm not saying these are the only two possible things, but usually these are the two viabilities. If not, there are abnormalities as well. So XX or XY. So primarily what we say is a person who has a homologous chromosomes, which is XX, is said to be a female, usually, not always, but usually, and XY to be a male. Of course, you should know that this comes with a little bit of a pinch of salt as well. The female characteristics are uh, carried out by some of the genes that are present in the long arm of the X chromosome, whereas the male characteristics are primarily determined by some of the genes that are located in the short arm of the Y chromosome. So just know this, but we'll be looking at this in a very clinical perspective in the future. Right. Um, so initially, what would happen is that now in all fetuses, usually it develops as a female. Initially, develops as a female. However, as female. However, in the presence of the Y gene, what would happen is that now it has a particular locus where a few genes are present at a certain region, which is known as a SRY gene. The presence of this gene causes production of two hormones, anti-Mullerian hormone as well as testosterone. So what you would probably see is that anti-Mullerian hormone will act on the Mullerian system and will destroy it. So this destroys the possibility of the formation of uterus as well as the fallopian tubes. And with that, it destroys Mullerian system. Good. And enhances the development of the Wolffian system as well as the testes. Now, testosterone causes virilization of the fetus. What does it mean? Virilization. The term virilization means it causes masculinization of the fetus so that it forms a male characteristic containing individual. The virilization usually causes the development of a scrotum, the development of other sexual characteristics, primary sexual characteristics, as well as now with the presence of the primary, it goes to it has the possibility or the necessity to develop as a secondary sexual develop the next secondary sexual characteristics as well together with it. So nothing to be there's nothing to be completely confused about. It's something that these two hormones carry out as a function. So the SRY gene is the basis of this. Now, a problem that we use sometimes encounter with some of the male fetuses is the fact that now, even though it has testosterone, there is a problem with the receptor. The absence of the receptor, absence of testosterone receptor. Now, this is something congenital, testosterone receptor. Now, even if the testosterone is the hormone is present, however, it cannot respond to it. Therefore, what would happen is that now these individuals do not bear the characteristic features of a male. Now, yes, they have testes, but will not develop secondary sexual characteristics. What are those? They will not develop any facial hair, any bodily hair. The enlargement of the scrotum would be much smaller, much less, and uh, the and also the spermatogenesis will not take place. Therefore, they are sterile. And the other fact that I would like to bring is now they have the testes, but they are sterile. However, and also some of the, even though it's not much of a major concern, but one cosmetic feature that most men are having a difficulty with is with the balding. So they will never lose hair in their heads. So they will never undergo balding. So this is something very trivial, but again a characteristic seen. So these type of individuals are termed as individuals who are having androgen insensitivity syndrome. These, mind you, this might come as an MCQ even in gynecology and obstetrics, but what you have to know is that these are sterile individuals. But do they have their uterus? Now that's something that we have to know. Now, if an ultrasound scan is done, they will never show a uterus. This is because now the SRY gene is present. Therefore, AMH was released. It does not have receptors of testosterone, true, but not to AMH. They show normal sensitivity and even normal responding to AMH. Therefore, their malaria system is destroyed completely. So they will never have uterus or fallopian tubes. Right? They have their testes, they are sterile, and they do not show secondary sexual characteristics. So androgen insensitivity syndrome. Now, about sex chromosomes, yes, inactive in the male is the X chromosome. Now this has to be complete. X chromosome, is the X chromosome inactive in male? No, in fact it is the only active X chromosome. Most of the genes reside in the X chromosome, not in the Y. There are few X chromosome containing genes which are not transcripted and not translated, therefore will not have manifestations. However, it's because of the inactivation that is carried out by Y only to few genes, not to each and every one of them. The X chromosome in males are active completely, but is this the same in the females? No, it is not so, because now in a female, what would happen is that only one of the X chromosome is active in comparison to the other. The other will degenerate to form a body which is known as a Barr body that is not functional. So a normal female will comprise of a single Barr body, but this is bit different when it comes to other individuals. Now, a normal male, will they have a Barr body? No, because there's only one active X chromosome, so that has to persist and carry out its functions. But in a Klinefelter, a person, an individual who has been formed with the non-disjunctioning of two X's with a Y. Now these individuals, if you can remember your advanced level genetics, these individuals will have few different features to that of a male. Now, what do they show? Now, this they show a typical female type body pattern. Female body pattern. The presence of breasts and also broad hips are some characteristics that they show. In addition to these, they will have somewhat a smaller uh, penis, and even the scrotum would be much smaller, and the testicles along with that, and will not develop much of facial or bodily hair. And and also some the energy factor is more or less dependent on the presence of testosterone. So these are individuals who do not have that much of energy in them. They are a bit weak, and their bones also has a higher potentiality to not to um, be much tensile in nature in comparison to that of an actual male. And but the key factor that you should know is that the people with Klinefelter are usually tall. Why is this? Now, a tall individual comes a man who is having who is having issues with fertility. You have to think that there is a possibility that this patient might be having Klinefelter syndrome. Why is that? Why is the patient tall? It's because now the fusion of the now I'm just trying to give each and every fact about this. The fusion of the epiphyseal cartilage is dependent on the presence of testosterone. Once testosterone is there, it undergoes fusion in a quicker manner. So therefore, the elongation or the lengthening of the bone will not take place for a longer period of time. The Klinefelter syndrome, however, they will not have sharp they will not show sharp growth spurts like the normal males, but a slow growth spurt which is present for a longer duration of time. They even grow at their 20s, unlike to that of a normal male. So tall individuals. So this is so in Klinefelter syndrome, because of the presence of 2x, what you would see is one of them will undergo degeneration to form a bar body. Therefore, there is the presence of a single bar body in their cell. The other would be a triple X female. A triple X female. This is actually called superwoman, but not it is not as literal as the name suggests, but because of the fact that it's not very sometimes these individuals may or may not have that much of intellectual capacity, might be slightly lower than a normal person, and even uh, appearance wise is quite similar to a normal, but still might show certain subtle changes, such as the the height and even the weight, and sometimes are a bit deranged, as well as they might have higher susceptibility to metabolic syndromes. So something a bit beyond your level, not required in fact. But what you can see is now there are 3x. Only one of them needs to be functional. The other two will degenerate to form two bar bodies. So in a normal female, you'll have a single bar body. In a normal male, there will be no bar bodies. And in Klinefelter, you would see a single bar body, even though it's a male. In a female who has triple X's in their sex chromosomes, there is a possibility that not a possibility, but there you will see the presence of two bar bodies, right? So inactive in a male, it's actually a false statement. False statement. It is inactive. One of the X chromosomes can be inactive in a female, a normal female, or a superwoman in 3Xs. During spermatogenesis, the X chromosome forms a chiasma during crossover. Uh, it's something like this. The X and the Y chromosome, usually the homologous pair, will form a junction in between. It is known as chiasma. It is something very temporary which allows crossing over of genes. Now this is evident in almost all the other chromosomes, but not in the sex chromosome usually. Usually chiasma can be formed and it will allow the crossing over of genes, but not usual. Therefore, this during spermatogenesis, X chromosome forms a chiasma during crossing over. It's false. Right. The other statement, now they have said certain things about X-linked uh, problems. One would be Duchenne's muscular dystrophy. Now, I'm not going into detail about Duchenne's muscular dystrophy because I will be giving another small video regarding Duchenne's in a more clinical perspective. But just for your facts, Duchenne muscular dystrophy gene is carried by the X chromosome. Yes, that is why this is a recessive disorder. Recessive disorder. So even in the presence of a single, now let's assume, now we'll take a male and a female who has the defective gene. I'm going to attribute it by G. So this individual is unaffected. Why is that? Because the normal X chromosome uh, will function and will not have an influence on the manifestation. However, when it comes to males, if the gene is defective, yes, this will come as Duchenne's muscular dystrophy. You would see that there is proximal muscle wastage, and usually the child dies of respiratory compromisation as well as cardiomyopathy. So Duchenne's muscular dystrophy gene is carried by X chromosome. Yes, that's a true statement. True. Two Barr bodies are seen in a somatic cell of a female with three X chromosomes. Yes, as I said earlier, it's a true statement. The superwoman. Sex chromosomes, it is an acrocentric chromosome. Now, what does this mean? The centricity of the chromosomes is something like this. Now, according to the position of their centromere, they have been classified. If it is present at their edge, it is known as telocentric. In between, where there is the formation of a short arm with a long arm, so asymmetric, it is known as acrocentric. And then there is submetacentric and metacentric. In metacentric, it is present completely at the center, but in submetacentric, it is slightly dislocated, slightly off from the center, so that you can see a short and a long arm. Now, acrocentric, you would see usually at the end. So there's an obviously a short arm along with a very prominent long arm as well. Now, this of course has to be remembered. Now, in this statement, what they have been asking, it is a acrocentric chromosome. It's something like this. Y is acrocentric, whereas X would show metacentric, submetacentric. So again, Y is the one who actually show acrocentric, but submetacentric is shown by X. Hence, when it comes to the about sex chromosome, it is an acrocentric chromosome. Better to take it as a submetacentric, but I'm not completely sure how this has to be done. They have to uh, be specified about whether it's a Y or a X. Usually, you would see acrocentric chromosomes that can be taken as true, because in Y usually it is more towards the uh, the the um, the terminal aspect of the chromosome. So again, a true statement. The other statement that we are looking at would be it carries the gene for the blue and green color sensitive pigments. Now, if you can remember, there's a separate disease which is known as red-green color blindness. Again, dependent on X, they're dependent on some of the genes that are located within the X chromosomes, and if they are deficient or not present in such a way, there will be problems on identifying both red and green. It is particularly due to the green and the red sensation is by two cones. The red is uh, uh, I'm sorry, this could be yeah. The red color is usually seen by pigments which have a green sort of a tinge, and the green color is seen by red pigments. So it carries the gene for blue and green color sensitive pigments. It's a false statement. Uh, this is again something very you should know about how the complementary color sensation takes place, but not very necessary at your level. But it is how it is been. In a certain state of a disease, the long arm of X chromosome is fragile. What do you know about this? Now, there is a disease which is known as fragile X chromosome, fragile X syndrome. Now, if you can remember, now what happens is that in a fragile X disease, you would see the problem in the long arm. Yeah. In the X chromosome, the long arm will have a repeat tandem. I'm not completely sure which disease, but as far as I remember, it's something to do with CCG. This will be repeated as a tandem. So you will have a long line of codons which are not coding for anything. It's just a tandem repeat. This will cause a certain fragility in the X chromosome. Because of that fragile nature, it will have manifestations, particularly in the nervous system, where it will not allow the production of certain proteins. Therefore, such individuals who have this particular disease will show intellectual disability with autism spectrum disorders. Of course, they will have few changes or manifestations in their skeletal structure as well as their fat distribution. Should know this, but not very prominent. They will usually have pointed chin, prominent jaw, prominent jaw, and the presence of large ears with a broad forehead. So these are some things that you would see. Another important factor should know is the presence of large testicles. They have macroorganism. So these are few facts that you should remember. Broad forehead, long face with large ears, and prominent jawline. Also, they have high arch palate and mitral valve prolapse, but this is high arch palate as well as mitral valve prolapse again is seen in certain other features as well, such as Marfanoid syndrome, because it is not something unique to Fragile X syndrome, but you would see that as well. Yeah. So, what does it mean? Certain state of this long arm of X chromosome is fragile. Yes, that's a true statement. Right. We'll move on to Fragile X syndrome because this was again questioned in some of the past papers as well. So I have taken um, some statements that have appeared and I'm going to discuss them. So this is not recessive, but it is a dominant form of a disease. So therefore, even the females who has the defective gene will be affected because it's the dominant form. Now, it is seen in both sexes, yes, true, but more in males. Males are more affected than females, and is the commonest inherited mental retardation. Yes, this is a true statement. Mental retardation per se, you can say that there are intellectual disabilities, will show autosomal spectral disorders, and will show a lower IQ. So those are few criteria that you should know. Now, you should associate with macroorganism. Yes, that's a true statement. True statement. Yeah. There are no educational abnormalities. False statement, as I said, there are intellectual disabilities. It's an X-linked recessive disorder. False. It's autosome. It is X-linked X-linked dominant disorder. Tip of the short arm of X chromosome is fragile. Now it's a long arm that is involved. This false. Right. Patients usually have a low set of small ears. No, it's in fact it is large ears. False. Right. Uh, Before finishing this up, I would just like to tell about Turner syndrome as well. In Turner syndrome, it is the absence of one of the chromosomes in the 23rd pair. Uh, there's only a single X, but the other is not present. Therefore, these people, these are actually females, will have short, will show subfertility and have these webbed neck, and the secondary sexual characteristics are not very prominent. Right, so this is Turner syndrome. Where this in this I just wanted to go through some of the questions which were really tough and will required so much of theoretical knowledge. So if you know this stuff, it's more than enough. I don't think that any question can appear uh, apart from this in addition to this, it's not something that is typically to be seen in a question paper. So with this, I have discussed two tutorials regarding genetics. Further, in the next coming lessons, I will be probably looking upon few other syndromes as well as some genetic questions that were given in the Colombo past papers. So thank you for watching this, and we'll meet next time.